Welcome to Smut, Did You Say? Hosted by Nurse Nikki in association with Queerlana. Before we begin, please note that the views and opinions expressed are those of the host and guests and not necessarily Queerlana as a whole. This podcast is for educational and resource purposes only. It is not intended as medical advice, legal advice, or a substitute for professional care. Because of the nature of healthcare work, we may discuss heavy or sensitive topics, including mental health struggles, suicide, sexual assault, death, or violence. Listener discretion is advised, and this podcast is recommended for adult audiences age 18 and older. If you are in crisis or need immediate support, please reach out to a qualified professional or call your local emergency number. Okay, on to Nurse Nikki.
All right, girls and gays, thadies and gentlethems, it's time to answer Smut Did You Say, where we'll expose ourselves to uncomfortable truths, plow into some pillow talk, and get those burning questions looked at. I'm Nurse Nikki, she, her. Today's guest is Beverly. Please introduce yourself and tell us what we're talking about.
Hi, I'm Beverly Maurice. I go by she, her. And we're talking about allyship and a little bit of religion and a little bit of a mishmash, right?
Yeah, a lot of different things.
So I'm excited.
I am excited too. So we've talked a couple times, met at did we meet at the PFLAG meeting?
We did.
Okay. So I crashed a PFLAG meeting, and there were just a lot of things that I felt very drawn to. I just don't have, I'm doing a lot of things. So it's hard to I want to be involved in everything that I believe in, but that's just, there's a lot of things. And that's good that there's a lot of opportunities to join in helping the community. There's a lot of opportunities to advance your knowledge about things and to just show your support. And like I said, I want to be involved in all of them, but there are a lot of things. Speaking of, you are involved in a lot of things. So one is that you're on the PFLAG committee, right?
Founding board.
Yeah. And you also work with the NAACP.
I'm on their executive board.
On their executive board. You are an instructor.
I am an instructor in terms of...
at the Rowan.
I'm a substitute teacher.
Substitute teacher. Okay.
At several high schools and the Rowan Cabarrus Early College.
Okay. And then you are a Jewish minister and clergy.
Mm-hmm.
And you're just involved in a lot of different things. And
exactly.
Tell us how you were introduced to the LGBT community and how you became so involved in everything.
Great, I'd love to. So I think I was introduced to it way back when in high school in the 70s. I had friends back then who were gay, and one of them would come over and do my makeup when I was going out for a big time.
Tell you what clothes to wear.
Yes, nothing better than a gay friend.
Well, I mean, it's just
dressing.
Honestly, you'll be like, does this look good on me? And they'll be like, no.
No, exactly.
Yeah, but it's no judgment or anything like that. They're just answering your question. And I love that.
Exactly. So good experiences back then. And then later on, I felt like I made an impact when I was a non-traditional day student at Catawba College.
Mm-hmm.
I was lucky enough and fortunate enough to become a second mom to many of the gay young men there that were attending. They knew that they could reach out to me and that I would serve as a second mom, and it was really great. Sometimes I saw a little bit more than I wanted to see, like a boyfriend at a strip club.
You're like, alrighty.
but in general, it was just kind of an honor, and, I've just had a warm spot because I feel like everybody deserves to be loved.
Absolutely.
And, going back to my religious beliefs, God didn't make any mistakes.
Right.
And can I prove that? Yes, I can prove that through psychology and science and stuff too. So there's never been a reason for me not to love the LGBTQIA plus community.
Or the Black community, because
or the Black
obviously, yeah,
community. Exactly. I
yeah,
mean, they are dealing with racism and
still,
taboos
still.
and everything, and
And health disparities too.
definitely health disparities. And you and I have another thing in common. You're a nurse,
Hmm.
and I'm a bioethicist, and
Right.
that was another
Oh,
thing
that's what, yeah.
that drew each other,
Yes. So
drew us to each other.
that's what I don't think I knew that you were a bioethicist when I was talking to you about that issue that I was having,
Hmm.
but I knew that you were part of the NAACP. So with the second time that we met, I was having an issue at work where I was trying to figure out what I was going to do about an issue that I thought might have to do with race. And I said, I was telling you, that this was happening and that I thought that care was being withheld based on the patient's race. So you asked me something that I will never forget. You said, if you are still thinking about this 3 days after it happened, what are you experiencing? And I said, moral distress.
Hmm.
And you said, and that is what kind of issue? And I said, ethical. And so you asked me what I would do about that, and I told you that I put in like a care event that went to risk management,
Yes.
and you told me corporate compliance
Hmm.
will have an ethical board, and that the ethical board is staffed by chaplains. And so that sent me on this whole thing that I sent you about my presentation called Empowering Equality,
Yes.
which is mainly because of that question that you asked me.
Hmm.
So I set up this whole thing where I gave a presentation at a Pride conference about what you do if you experience discrimination in the workplace. And I found all these things just by looking it up. And I posted it was at the company where I work, the organization where I work, which I'm not going to badmouth or really talk about specifically, but their mission includes the phrase for all,
Hmm.
or like for everyone regardless of blah blah blah. And I'm still having trouble getting this organization to realize that there are a lot of things that can be done better to improve healthcare for underrepresented minority groups, which obviously includes the LGBT community, but also, like we were talking about, there's health disparities among any people who are not heterosexual cisgendered white males.
Exactly. And
And
that's a big
so
problem.
yeah, and that's a big group of people.
Hmm.
So there's so when I went onto the website, I looked up corporate compliance, and it was like there's a reporting center, and the reporting center had report a concern, and then it was like, what kind of concern is this? And discrimination was an option. So I chose that, and then I wrote out my explanation of what happened and why I felt like I needed to be talked to about it. And then a couple days later, somebody from corporate compliance called me, and she thanked me like no less than a dozen times.
Also.
And she told me that it was an underutilized, resource, and that with us joining with, like, a larger company, we now had access to way more people on the ethical board, and I didn't talk to a chaplain about that specifically,
Hmm.
but later when I talked to chaplains, like, at other places, I told them that, like, that nurses don't know about this, that nurses don't know that chaplains are part of the ethical board, and they don't know that a chaplain is there not only for patients, and they think it's just, like, when patients are dying or something like that,
Exactly.
but if
No.
anybody's having any sort of emotional
Hmm.
distress, whether they're any religion, it doesn't matter, but a chaplain is supposed to be unbiased.
Exactly.
So a chaplain comes and they can have their own religious beliefs or anything
Hmm.
like that. But they'll come and they'll just support you and they'll ask you, how can I support you? And that's kind of the first thing, because they'll be like, well, can you pray with us? Or they'll be like, what do you do? They're like almost like therapists in
Exactly.
that way. So I talked to a couple chaplains where I work, and they were all really excited about me sharing how to report discrimination and letting them
Yes.
know that the chaplains are there just to help. And I had a situation later on where, there was a weird situation with a kid and the parents seemed to be fighting a lot. I was telling the provider, like, "Do you think that separating them and talking to them separately would be best?" And she was just kind of like, it just she was okay with doing it, but it seemed like a lot.
Hmm.
And I was like, "Why don't you call the chaplain for support?" And she was like, "Oh, would they do that?" And
Yes, they
I
would.
was like, not only to be a third party for when you're talking about potential child endangerment or
Mhm.
child whatever, anything, um, is it sounded like the mom was blaming the dad for something that had happened and that they were kind of going at each other, but the kid was in the middle of it. And that just sounded like an ethical concern and a like potential like not exactly like case management, but just maybe somebody needed to be there and they could offer resources as far as like we could have social work reach out to you and try to get some like family therapy or something
Mhm.
going, but they can recognize those kinds of things and
Exactly.
they can be another sounding board for us if we are worrying about something that's outside of the physical realm of the patients.
Yes.
A lot of people don't realize that chaplains are there for more than praying with people and more than people dying and more than just like traumatic events and stuff like that. Like you don't have to just call them when you're doing CPR on their family, and you don't
Exactly.
have to just call them when their kid was in a traumatic accident. Like
This
it,
is so true. I
yeah,
mean, I had the pleasure and privilege of sitting, it was called CMC back in the
hmm,
day,
yeah,
but now I believe it's an Atrium,
atrium advocate, yeah,
Maine,
yeah,
and it's attached to Levine's Children's Hospital.
yeah,
And I had the opportunity to sit on their ethics committee for a number of years.
yeah,
And, we had that very instance of not needing to provide a service to the patients, but to the doctor and the
hmm,
other chaplains that were actually involved in a particular case.
hmm,
It caused them such high moral distress,
yeah,
because the doctor was wondering, did I do enough?
yeah,
And he really had. This was a heart transplant patient,
yeah,
and the family, because of religious beliefs, ended up withdrawing their child from care,
yeah,
and the child went on to pass away,
right.
and the new heart was there on premise,
But they didn't.
and they didn't want it.
Yeah,
So, I mean,
there's a
this
lot of
is
moral.
doctors being human,
Yeah,
and nurses being human, and even chaplains being human.
yeah,
So that's why to have them in that kind of area and space is like amazing. And it's sad that, more nurses and possibly physicians aren't aware of that's
right.
what they're there for.
So we're after we have an event like doing a code, whether the patient survives or not, we're supposed to have a debrief, and
Hmm.
a chaplain is supposed to be present for that. And so we're supposed to talk about like what things went well and what things didn't go well and what we could do in the future. And then if anybody has any sort of distress related to that, we're supposed to be able to talk about it. But everything is happening so quickly in the ER that that rarely happens. And so, like, we don't call another team, like, we don't call rapid response like they do on the floor. We are the rapid response.
Exactly.
So you walk in, you see a patient in distress, and you check for a pulse, and if there's no pulse, you start CPR.
Hmm.
And if the patient's not breathing, you give them oxygen. Like you just act. And then
Hmm.
you're supposed to, like I said, debrief, but what actually happens is that you leave and you go to the next patient and you answer the angry patient that asked you why it took so long to get their pain medicine. And you were like, sorry, I was doing chest compressions. Like
Hmm.
they don't realize that there's such this spread of things that happen in the ER, but we're expected to just jump from one thing to another because it's so busy all the time. And we can go into why it's so busy all the time, but
Yes,
that's a whole
that's a
nother thing.
whole
Yeah, so
bundle of
yeah,
issues.
but yeah, I mean, like, it's just nurses and doctors and everybody in the healthcare field, including the chaplains, go through so many emotions per day,
Hmm.
and, we lack so much support, and I have support that I can link to this for nurses and doctors that are going through issues. There's one called Nurse Rescue, there's one called, I think it's called For You, and then Emotional PPE are a couple ones that talk about healthcare providers outside of work. And there's also EAP. If you work for a healthcare facility, they have employee assistance
Assistance
program,
programs. Yep.
and often that offers 6 free visits with
Hmm.
a therapist. Um, and per issue. So particularly for Atrium Advocate, they offer 6 per issue, and I believe that Novant does as well. And I've utilized both of their programs, both Atrium and Novant, because I've worked for both. And they were both wonderful, and they were both during these times where I was just having an awful time, and I just couldn't focus on work, and I was blaming myself for things during the pandemic that I couldn't control and wasn't prepared for.
And that was an exacerbated
Oh,
situation on
absolutely.
top of it. I mean, it's one thing to be this rapid responder,
Mhm.
but during the pandemic, it was a
Nobody knew what we were
whole
doing.
different level.
Absolutely
And
nobody knew what we were doing.
there had to be some fear in all of your minds about, well, I contract it because of what I'm doing.
Yeah, or that, like, when I saw my first COVID patient die, and I was like, I feel like that could have been prevented. But
Mhm.
the doctors assured me that we don't know anything about this disease, and that person was already predisposed to having trouble with it,
Mhm.
from having other lung problems, and that was what they expected to happen when they had that patient. And I still deal with lingering guilt
Mhm.
and
Some
stuff.
PTSD.
PTSD. Yeah,
Yeah.
yeah, we could definitely call it that. Which is something I need to talk to my therapist, I guess. We just got on my daddy issues, so that'll take a while. But yeah. So that's been an interesting one. So we've talked about the ethical component of healthcare. It sounds like people are like drawn to you. Like people know that they can trust you, whether it's because like you said, you were like a mom, and you were with a lot of younger adults,
Mhm.
and they kind of gravitate towards the mom. Like when you have an older nurse who's been doing it for like 30 years or whatever, they're like the mom of the
Yes.
unit. I've had my friend Kim actually was like the nurse mom, and she's started some resources for nurses as well, with everything that they go through. So I will link that as well. Let's talk a little bit about what you do for the NAACP.
So I was very excited and very honored and humbled when I not only became a member of the NAACP, and they are amazing in what they do for the community, and I
Mhm.
can go into a long list, but I was actually elected to be the assistant secretary. And that has opened up just a world of knowledge to me. I'm also the committee chair for the health committee, and I don't really have a committee yet, but I'm working on
Yeah,
that. But I have,
we talked about giving talks about healthcare specific things with the Black community. Which,
Mhm,
like you said, we could go into a whole list of things, but a lot
exactly.
of our birth issues with mother and baby, they
Hmm.
have a lot of birth complications for no reason. And well, the reason is racism, but yeah, for no real like healthcare reason. There's no reason that they should go through that. The kidney stuff,
Yes.
where so there was a measure called the EGFR, and it used to be
Hmm.
like, even since I've been a nurse for the last 7 years, 7.5 years, when I first started nursing, the GFR said African American or not. And that's a glomerular filtration rate, which means how fast the kidneys are filtering waste. And it was thought that since Black people had better muscle mass, or like more ability to
Hmm.
create muscle mass or something like that, which is not true, that they would have a naturally slower glomerular filtration rate
Hmm.
because they were or faster. It was one or the other, but like either way, it predisposed a lot of Black people to ending up having to get dialysis because their care of their kidney issues were delayed. So a lot of people ended up in like end stage renal disease and getting
Yes.
dialysis when it was just all this stuff wasn't done beforehand. So either they weren't taken off of medicines that were affecting their kidneys,
Hmm.
like
Probably they're diabetic
antibiotics, diabetic
medications. Hmm.
medications, steroids, anti-inflammatory medicines. So there are several medicines that affect your kidney function, and if they don't think that you're at risk for like kidney failure or whatever, they're not going to tell you not to take it. But if they do, they'll start saying like, okay, let's change this. And diuretics as well.
Hmm.
Diuretics, a lot of diuretics mess with that. So yeah, they're just like a lot of things that were done incorrectly just because of these like weird things. I felt like when I started nursing in 2018 that we probably should have known that Black people don't have more muscle mass than white people or don't have different muscles or whatever. Because there was like that thing, I don't know how long ago it was, where people were saying that Black people ran faster because they had another like muscle in their leg.
Mm,
I know.
I haven't heard that one.
Yeah. So,
Excuse me.
but no, I mean, there's no research about that.
No.
And the story that I heard in this training that we had to do, and this was only like a couple years ago, was that a nurse came in after giving birth a few days before with headaches and vision changes and high blood pressure, and that's a sign of preeclampsia. Gestational hypertension can lead to preeclampsia, and preeclampsia can lead to eclampsia, which is seizures, and that can lead to HELP syndrome, which I can't remember what it stands for, but it's bad. And so up to 6 weeks after giving birth, if you continue to have symptoms of preeclampsia, that's an emergency.
Yes.
You need to go to the ER. If you're having vision changes, headaches, continued high blood pressure, if you're using those strips that tell you if you have protein in your urine, like those things are emergencies. And she was being ignored because they were telling her, you know, like, well, you've already given birth and this isn't an issue. And the only reason that she got the care that she did is because she knew, because she was a nurse.
She was a nurse herself.
Yeah.
Which
So
is not fair. I mean,
I tell people all the time, I have a hard enough time getting my care the way that I need it, and I know how to get it. People need to be able to advocate for themselves, but they don't know how unless they have somebody helping them.
exactly. And that's been a problem for a long time. I
Yeah.
just wanted to go back to the NAACP for
Yeah.
a minute in terms of they have come out to talk to PFLAG to let them know, let the LGBTQIA community know that if there is actual harassment that is not resolved by the school or the workplace's ACLU, the NAACP will step in.
Really?
Yes, and they will defend an LGBTQ QIA
That's amazing.
person. So they don't look at your skin color. I mean, you know,
Yeah, and I asked
or
you, are you Black somewhere in your heritage or whatever, and you're not. The council previously known as the DEI uh is like everyone. So the people that are in charge of that committee are generally not representative of everybody that they are helping. So it's really nice to know that another group will say, well, we're advocates and it doesn't matter
exactly.
who you are. If you need advocacy, like come to us. But another thing is that if you are a healthcare provider or a patient and you've experienced discrimination in the hospital, you can report it to the Joint Commission. 80% of hospitals are covered by the Joint Commission, and they're the ones that set the regulations and things like that, the ones that everybody's supposed to follow. And if you experience discrimination and your organization is doing nothing about it, you can report it to the Joint Commission because the Joint Commission's equity and inclusion stance covers every hospital that it covers. So if you're saying this Joint Commission hospital is not following these rules, you can report them as an entity.
Absolutely.
Or as an entity or as a provider specifically. You can also report providers specifically to their licensing board. So the medical licensing board, you can report doctors, and the nursing licensing board, the NCBON or whatever board of nursing for that state. PAs are on the medical licensing board and NPs are on the board of nursing. So you can report them and you can look them up by their first and last name and what state they practice in, and you'll get their nursing ID number. And then the medical board, you can say like find a provider and it'll help you find that provider that you're looking for. Like I said, people don't realize that. And if you know my first and last name and my maiden name, you can find me very easily. And
So I do have some concerns now. I do have grandsons that are biracial.
okay.
And so it's just another motivation for me to be caring.
Yeah.
Plus, I grew up in New York, so right outside of Manhattan. I was born in Manhattan at Mount Sinai Hospital,
Yeah.
which is where my master's degree in bioethics comes from.
Okay.
So that's pretty cool,
Yeah.
round, full circle.
Right.
But, you know, moving down here to North Carolina just showed me how great racism is still not only in play, but just out in the open. And,
Yeah.
I went to
And
school
accepted
with
and expected even. So,
exactly. And
yeah.
it was just so disconcerting to me. And it's just always laid so heavy on my heart that, becoming a member of the NAACP was just almost a natural progression
Yeah.
because even from a religious standpoint, the Jewish people, so I'm Jewish,
Mm.
um, have always stood alongside Dr. Reverend Martin Luther King Jr.
Mhm.
during the civil rights movement. We've understood that people are people,
Yeah.
and, there's not first class people and second class people.
Right.
We're all
And
people.
Martin Luther King Jr. would have stood up with the queer community. I don't know if he actually
Hmm.
said anything about it because they were dealing with similar issues at the same time. But I mean, his message is very much about like all people. It wasn't just about Black people.
Exactly.
So,
I mean, in his "I Have a Dream," he speaks to all races, all
yeah,
religions. I
right.
mean, he even names like Judaism and
Yeah,
stuff. But he wants for every boy and every girl
yeah.
to be the most potentialized they can be. I
Don't
think I made a word.
Yeah,
Yeah.
potentialized,
Yeah.
that
I like it.
reach their maximum potential.
Potential.
Yeah,
Hmm.
I mean, you were talking about 10-year-old that you knew was gonna end up being a young gay man,
Hmm.
and they get consistently pulled down from their maximum potential. They get, "Don't do that. That's too feminine. Don't wear that. That's too
Hmm.
feminine. That's too this, that's too that." And I mean, that's the same thing with, like, neurodivergent kids being either autistic or ADHD or,
Hmm.
any queer type of person. Like, you had tomboys,
Hmm.
but, a lot of times those tomboys ended up being lesbians. But it was like, "Don't wear that. Those are boy clothes. Like, you look like a boy. Are you trying to be a boy?" Stuff like that. I have a friend that is queer, and they're just kind of whoever they want to be in that
Hmm.
moment, which I think is beautiful.
I
And
agree.
they are a belly dancer, and they are also in a metal band and
Hmm.
stuff like that, and they're
That's so
just
cool.
yeah, and they're just like this always been this person who didn't want to wear whatever everybody else was
Hmm.
wearing. It didn't want to do what everybody else was doing. Wanted to climb trees and get dirty and be weird and listen to Queen and
Yes.
and um and just be themselves. And they grew up in a hyper religious family where everything that wasn't church supported or whatever their interpretation of the Bible was, anything that wasn't that was not okay. And I grew up thinking that anybody who didn't go to church and didn't identify as a Christian was not a good person. And then I came to find out that that's usually the opposite.
Hmm.
Um,
Exactly.
so yeah. Tell me about the Jewish faith and how that plays into allyship.
So I was born and raised Jewish, and there's even a funny little candid camera YouTube from
Oh,
back in the
really?
day where my mother had kind of been drumming into me that I liked Hanukkah better than Christmas.
Yes.
But I wanted to say I love you to Alan Funt dressed up as Santa Claus, but I was like, I like you.
Oh.
Um, so anyhow, it's black and white, but you could still pull it up on YouTube.
Hmm.
But
Black and
I
white
had
candid
an
camera.
Orthodox grandfather. By Orthodox, I mean that he never drove. He wasn't a rabbi, but he kept a kosher home, he and my
Hmm.
grandmother, and he walked to the synagogue all the time. He would take me and just a good person, just went to visit the sick in the hospital.
Okay.
And I think he had the biggest impact on me. And it was so interesting my late second husband was not Jewish. And it was so interesting to see how my parents and my aunt and uncle were like, how do we tell grandpa?
Yeah.
Well, when we told grandpa, being that kind of righteous person that he was, and here he was an Orthodox Jew, he was fine.
Yeah.
He was fine. He just wanted what was going to make his granddaughter happy.
And that's what everybody should want. Whatever
Mhm.
makes you happy. And like as long as things are consensual between all parties and blah, blah, blah. Like,
Exactly.
whatever makes you happy should be what people want for
Hmm.
you. And I just don't understand trying to dole that for somebody that you supposedly love.
Exactly. So I'd have to say, I dedicated my thesis to him,
Oh,
because I feel like that's who gave me my morals and ethics.
yeah.
Not my parents so much, but
Yeah.
my grandfather
I love
right
that.
there. He was just an
Grandparents are
awesome
sometimes grandparents are
person.
just I had 3 sets of amazing grandparents, and, one set is gone and half of another set is gone, but the ones that I still have, I hold very, very close and dear to me, and they have, supported me both emotionally and sometimes financially, and that it's just a blessing to have somebody in your life, whether it's your parents or another family member who is that supportive of you
Hmm.
and that what is it?
Unconditional love.
Yeah.
I find that's what I do with my
Yeah. Yeah.
grandchildren. And
Yeah.
it's like, yeah, I
It's like you
want
can
you
come
to
to me with
grow up
anything.
the right way and
Yeah.
everything, but I'll be your compass.
Yeah.
I'll just make sure
Yeah.
that you're going the right direction in the very best sense of the word.
And as a bioethicist, you can kind of direct people based on their their trajectory, and
Hmm.
you can make them think about questions in a way that other people probably couldn't. Or you can say like you did to me, like, what are you experiencing right now because of this issue? And, kind of like therapy where it's like, "How does that make you feel?" You can kind of do that have you ever played that Scruples game?
Yes.
Yeah, so you
Hmm.
can play, like, the Scruples game where it's like, "Would you rather do this or that, and why?" And, like, "Does this feel okay even though this doesn't?" Like, "Would you steal from Walmart, but not steal from this, like, small
Small
business?"
store. Right.
Yeah,
Hmm.
and, like, why is it okay to steal from Walmart and not from there, and then you can kind of just direct them like you said, you can be their compass, but you can also help them develop their own, where it may not completely follow yours, but you can say, like, "At least think about it. If you're gonna go that
Exactly.
direction, at least think about it." But, I mean, even like the Nazi party, they thought that their compass was pointing the right direction because they thought that Darwin's research
Eugenics. Yeah.
yeah, eugenics, that's a whole thing.
Yeah.
But, they thought that Darwin's stuff was pointing towards eugenics, being like, "Weed out the bad ones."
Hmm.
No, it was just saying that things evolve differently. It was just saying that, like, this butterfly is eating this thing and it makes them taste bad, then that is a path that one's gonna go off. And then there was the ashes in England and the moths on the trees, and the ones that blended into the trees didn't get eaten by the birds. And so that, divergence happened. Or, like, you can separate the same species and put them in different environments, and one will go in one direction, the other will go in the other direction. It doesn't mean that there is a premium, pure whatever, which is
Exactly.
why the neo-Nazis are just
Yeah, I
they
mean,
want
we're
they
living in a scary time right now, and
yeah,
and this is all reminiscent. So I have the honor of having known and knowing some actual Holocaust survivors.
yeah,
So I am a friend to the North Carolina Council on the Holocaust.
okay,
And so that's afforded me these opportunities to meet survivors as well as in my congregation
yeah,
too. And the the loudest thing I heard was the first time that our president was in office, all these survivors said it feels like pre-Nazi Germany,
yeah, where they're getting people amped up, that
throwing issues at them left and right
yeah,
to not provide education to the general public.
yeah, cutting things out of history books, cutting things
Yeah,
out of museums. You're taking
yes.
stuff out of the
Taking away
Smithsonian, are you kidding me?
DEI.
Yeah.
Yeah, I mean,
Ooh, just taking away
yeah.
anything. So I was looking at Project Healthy People 2030, and originally, before he went in office, improving life for the LGBT community was
Hmm.
on there. Now it has like a redacted message that says this does not
Sadly,
follow
no
Trump's blah blah
surprise.
blah. Yeah. I almost can't like read these things because they just make me want to throw up. But the House bill that prevents people from obtaining gender affirming care if they are under the age of 19, I looked up the person who whatever council person
Mhm.
submitted that and his reasoning, he has no basis in anything other than religion, which, I
Mhm.
mean, if he was actually Christian, you would not be saying any of that kind of thing. Because, like you said,
Exactly.
God doesn't make mistakes. And I don't believe in God, but like, knowing the Bible and growing up reading the Bible,
Mhm.
that's my impression.
Exactly.
And my dad is incredibly um pious, I guess is
Mhm.
the right word. So he would tell me that free choice or whatever leads people to go astray, and then they become like lost sheep and all this kind of thing. But like I said, I grew up thinking all those people were terrible. I had a kid
Mhm.
in my class in second or third grade whose parents were divorced, and that was just like, and it was like, oh, that's against God. That's against the Bible. And it's
Yeah.
like, okay. And then now divorce is so common, and you realize that a lot of people shouldn't have ever gotten together. Or that
Exactly.
sometimes, even with friends, that sometimes that person is there for you for a season and
Mhm.
then their season runs out. And
So true.
and that's why I'm so down with ethical non-monogamy and
Mhm.
stuff like that. If you have needs that are provided by more than one person and everybody's, like I said, consensual in agreement and aware of stuff going on, then why not? So,
Exactly.
um,
But I'll tell you, I'm very concerned with them slashing these budgets
mm,
and rights to things.
yeah.
It's like so Medicaid, for example, people with end-stage renal failure, like we
Mhm.
were talking about earlier, they're on Medicaid.
Mhm.
And to say that a trans young person cannot receive their therapy that they started with, in my mind, that's like saying, okay, we're going to start you on a cancer treatment, but oops, nope, we're going to stop.
Well, that's what happens with diabetics and stuff, though,
Yeah.
with their medications. They start them on something and they say, oh, your insurance doesn't cover this anymore. And then
Hmm.
they put them on something else that causes all these side effects. But my thing about ending gender affirming care is if that person went through puberty before they started hormone therapy,
Hmm.
they're going to go through it again when they can no longer get hormones. And if they never did go through it, they're going to go through it when they can't get hormones. And if a kid is like 15 or 16 or even 18 and they know that it's going to be a while before they can get any gender affirming care, and gender affirming care is not just hormones and surgery, it's therapy, it's other resources, it's name change to affirm your identity, it's all this kind of stuff.
Exactly.
So they're saying you can't do anything to become the person that you feel like you need to be. And doing puberty blockers for kids that are either non-binary or trans, I haven't looked into like the science of it,
Hmm.
but it doesn't seem like it causes that many issues. And I was talking to a girl that was working with OBGYN, and they did some gender affirming care, and she was telling me about like the risks of cancer with taking different hormones and things like that. And I mean, that makes sense, but
Right.
I'd kind of rather have cancer and
Exactly.
be who I need to be instead of looking in the mirror every day and seeing a person that I don't want to be.
Exactly. And I think a lot of it goes back to, I hate to say it, but ignorance.
Yeah.
I mean, unless you've taken a really good psychology,
Mhm.
have a really good psychology background, and understand that a lot of times children are born with both sets of
Yeah.
genitalia, and you have parents
Or ambiguous
making
genitalia
or
and
ambiguous,
they'll do
and the
yeah.
doctor and or the parents make a decision,
Yep.
and you only have 50% odds of being right.
Right.
So it's not surprising how many people are not comfortable in their own bodies.
Right.
And so it shouldn't be surprising,
Right.
the number of people.
And people are saying that there's more trans people now than there ever was, and that's not true. It's just that more people are comfortable with being out
Mhm.
and trans. So, like I was telling the committee formerly known as DEI, that we need to be asking everybody in triage when they come into the ER what their name and gender is and what their pronouns are and put that in the chart. And they said, well, you're going to ask some 80-year-old woman who lives in and has been in the healthcare facility for X amount of years or whatever. And you're going to ask her her name and pronouns. And I said, yeah, because I'm going to tell her
Yes.
that we're asking everybody to ensure proper care and respect for every
So,
patient.
Nurse Nikki, you know that at my age, which is 65, I don't have a problem sharing that, they still ask me when I go to give blood, any chance of me being pregnant.
Right.
Anytime I have anything medically done, so steroid injections into my spine, any chance you're pregnant.
Yeah.
At 65, I like to think I have that part of my life,
Yeah.
which I do,
Yeah.
but like, they still ask me that. Why would I be upset about which pronouns I like
Yeah.
to use?
Right.
I mean, if you could
Exactly.
still ask me if I'm pregnant at 65,
Or if you like
please
just
ask me which pronouns I prefer.
right. So the thing is that in the ER, I've asked so many weird and uncomfortable
Hmm.
questions. No provider in healthcare, much less the ER, should have an issue asking somebody their pronouns. But I did make a little cheat sheet that you can put on your badge that gives a good way to ask without invoking an argument, which is to ask in between other questions.
Hmm.
So we have a list of questions where most of us say these are questions we ask everybody to ensure safety. It has nothing to do with why you're here. It's just what we ask everybody. And so any thoughts of wanting to hurt yourself or anybody else? Do you feel safe in your relationships and where you live? You are female and your pronouns are she, her, correct? Yes.
Hmm.
And then you go by Beverly, correct? Yes. Okay.
Yes.
What pharmacy do you use?
Mm.
So you can jump from one thing to another and just be like, okay, triage is quick fire.
Yep.
You shouldn't be having long
Just weave it
conversations.
in.
Yeah.
Yeah.
You should be getting the bare minimum of what they're there for, get kind of a picture of what tests you might need to do, and then you get all the other demographic stuff. We should also be doing social determinants of health and triage, but that's not happening either. And they're going to get a lot worse when the Medicaid and Medicare stuff starts.
Yeah.
So my thing was we should be asking everybody because you don't know who's been hiding their identity forever. And
Exactly.
maybe they would be comfortable if we just asked.
Hmm.
And a lot of people don't go by their full name either. So my name's Nicole. I go by Nikki. My wristband now says Nicole, and in quotations it says Nikki. My wristband says that.
Yes.
It used to just be in the chart. But I was talking to my friend Katie, who is an education person for the organization where I work, and I said, do you know how we can change our MAR, the system that we use to document
Hmm.
everything? Do you know how we can edit that so nurses can have access to change the preferred name? Because if I tell a nurse, oh, you have to go to registration to do this, that is going to get me a response from most people that says I don't have time for that.
Exactly.
Which is the whole thing with the ER being like, we don't do the debriefs and
You
whatever.
don't do long lines.
If
Yeah.
something takes longer than what I was already doing, I'm not doing it,
Hmm.
And I don't operate that way, but a lot of ER nurses do. And I mean, I do in some things, but not like important things.
Right.
But so people don't find that important because they're like, it's the ER, we're dealing with emergencies. Like, we shouldn't take time to do XYZ. It's like, okay, but if I was taking care of a patient and her name is Natalie, right? And I
Hmm.
go in and I call her Martha, and she's like, that's not my name. And I'm like, well, I don't really care. I'm just going to call you some name.
Exactly.
That's disrespectful. And that makes me, as Natalie, being called Martha, not want to listen to anything that that person is saying.
So true.
And you just kind of tune out. And why would you listen to them? And why would you do anything that they suggested you to do?
Exactly. Plus, I mean, in an
And why
ED
would you ever want to come
situation,
back?
exactly. In an ED situation, you are, as a patient, you are so scared.
Yeah, it's a really stressful
And
environment, both
you,
watching things that are happening
mhm,
and just being there yourself.
and you need to have every little acknowledgement
Hmm.
that is going to make you that much more comfortable, even if it's just that much more
And
comfortable.
especially if you're having a true emergency where
Hmm.
something is life threatening and things are happening, calling somebody by their preferred names and pronouns is going to make them feel more comfortable. It's going to make their
Exactly.
vital signs better. It's going to make
Hmm.
the medicine work better.
Right. So, I mean, it works
Yeah.
emotionally, it works physically, it just
Yeah.
works in every
And I'm
way.
sure, I mean, I would love to talk to a neuropsychologist
Hmm.
about the way that just like affirming and positive feedback works in the brain, because like I studied kinesiology, which is the study of human movement, and we did the sports psychology type
Hmm.
of thing, but positive visualization is so impactful on your performance. I was a really bad test taker because I had anxiety, undiagnosed for a long time. Turns out I have ADD as well, also undiagnosed or recognized for a long time. So I would have to take a deep breath and say, I know this, read the question, and then take a deep breath again and say, I know this, because oftentimes I did know the answer.
Exactly.
But I would just second guess myself, or I would just want to be done, and I would rush through it. And I was always the first one done with tests. And sometimes, yeah, it was one that I was like, Spanish or whatever. I would usually get in the high 90s, 100%
Right.
on my Spanish stuff. But when it was things like math, I'm not a math person. I just couldn't calm down to think about the question. It's just so weird how the brain works. But positive affirmations are really, really important.
They are.
And there's tons of studies about how people feel about being misgendered and dead named and having the wrong pronouns. If you look at the Journal of Emergency Nursing, there's several things. One was called, I think it's from like 2017. One was called I Felt Like a Freak Show. And it was just this person's talking about their experience and how they were called their dead name, they were called their other pronouns. But anyway, so I asked, is there a way that nurses can change the name? And so she emailed the EMR, and they were like, yeah, we can change that. So they changed it, but then they never put that out as education because they said people should be able to figure it out on their own. Okay. The education that we have, the yearly education for taking care of queer patients, is not only likely written by a straight person, but also the flow sheet that they show is only the inpatient view. They don't show the ER view. But the ER is where that's most important, where the part where they're starting. They're always going to start in the ER. They don't ever just go up to the floor. So they were telling me that there's all these initiatives for improving things and having name and pronoun on the board and stuff like that on the floors, but it's not in the ER. And I was like, it doesn't matter if it's up there. It's not like we can send every queer person that comes in to the floor
Straight to the floor.
that is accepting of them. Every floor should be, and so should ours. And so they were just arguing with me about that. And then I was like, well, how come we don't have their preferred names on their wristbands? And so when people are asking their name and birthday and looking at the wristband, they have to say what's on that, or else it's confusing.
Exactly.
And a lot of times those phones that we use, the Rover phones, don't have their preferred name on it. But now, because the company that we merged with had printers that were able to do that, ours are now able to do that.
Nice.
And I took care of a trans gentleman the other day, and I looked at his wristband, and I was like, it's there. And he was like, yeah, I noticed that. He said it wasn't there before the last time I was here. I said all it took was somebody to ask why it wasn't.
Exactly.
And a couple months of
But
changing
everything you're saying goes back to one of the core principles of bioethics, and that is patient autonomy.
Yeah.
So patient autonomy is everything in bioethics. Well, again, just one of the core principles.
Yeah.
But I would think that patient autonomy would include being called by your name of choice.
Well, it's about respect. It's
Exactly.
about allowing them to make healthcare decisions, which is also how you want to be identified.
Exactly.
And if you're allowing me to make healthcare decisions, but you're not allowing me to say, this is who I am, that's not allowing me to help.
defeating the purpose.
Yeah, exactly.
Totally.
Because part of my care involves being respected as an individual. A lot of times, if they were really on edge before and you ask them that, they're like, oh, thank God somebody here
Exactly.
is on
You
my
just
side.
threw them a lifeline.
Yeah.
You literally threw them a lifeline.
Yeah. And I've had like a gay doctor go in and misgender a patient because they had a very long name, so their name didn't show up on the chart he was looking at, their preferred name, because it was after everything. And so he went in and misgendered the patient, and he had to backtrack and apologize and be like, that's not who I am. And we're set up to make those mistakes even as allies in healthcare because of the way that the EMR is set up. And now on prescription bottles, they have your preferred name on them.
Oh, good.
At least
But we're not in a perfect world.
No,
we'll
not at
never
all.
be in a perfect world.
No.
But anytime you can make a stride like you did, you're to be called a hero because
it helps your your rapport with the patient.
Yes.
And then when you're giving education at discharge, they're going to listen to what you're saying.
Yes.
If you have pissed a patient off and you give them education at discharge, I guarantee you they have not listened to a word you said.
Exactly.
And maybe they're pissed off because they waited a long time, or they're pissed off because you didn't give them that medicine that starts with the D,
Mm-hmm. Mm-hmm.
they can be pissed off about that, but you can say, hey, you need to follow up with your primary care provider. You need to establish pain management. You need to do this. They haven't heard a word of that.
Yeah.
And then they're like, oh, just highlight the thing. Okay, they're going to throw that away, or it's going to
Mm-hmm.
go in a drawer or something like that. Like, but if you had a patient that you established a rapport with,
Right at the get-go.
yeah, they're gonna be like, "And what was your name again?" You get asked what your name is for 2 reasons. One, because somebody's really, really happy with you, or because somebody's really,
Really
really
mad.
obsessed. So, yeah, it's very interesting to be in the position where you have a patient who's really guarded,
Mm-hmm.
and then you can just say, "Hey, I'm somebody you can trust. It's okay."
It just smooths out so many bumps in the road.
Exactly. And if they got asked that in
Mm-hmm.
triage and it was appropriately documented that that is their name and
Mm-hmm.
gender, and their pronouns, and there's also a spot where you can document what organs they have and what organs they had at birth and what organs they currently have, and then there's
See?
actually a section where you write out if they have any plans for gender affirming care in the future. So in the future, when they come in, you can ask them if they have taken any steps in their gender affirming
Mm-hmm.
journey. So like the trans man that I had, when the PA came out, she was like, "So do I have to do a pregnancy test?" Because he was there for a urinary problem.
Mm-hmm.
And I said, "You would on any cisgendered female. Anybody with a uterus, you're doing a pregnancy test on." From
Exactly.
the age of like 11 to like
Mm-hmm.
65. And she was like, "Okay." And I said, "Yeah, so anytime you have a trans man and they're taking testosterone and stuff like that, you just ask what organs they still have, and if they haven't had a hysterectomy, and you can get pregnant." And a pregnancy test lesbian people all the time. I tell them, I mean, they said that they haven't had sex with a man ever, or they haven't had sex with a man in X amount of time. But they say if it goes to court for whatever reason, and they've said no, and I believed them, then I'm held liable for it. So anybody that has a uterus is going to get a pregnancy test. So if you're going to do it
Exactly.
to lesbian people and cisgendered women that are saying they're not having sex
And
or
I don't
can't
have
get
a
pregnant.
problem with that. It's not an invasive procedure to
No,
do a pregnancy
no,
test. And
but I think that it feels awkward to ask somebody who identifies as male if they
right.
can be pregnant. But I've taken care of a pregnant male before, and I've had to basically stand guard at the door because
Mm-hmm.
the clinical supervisor was out there giggling about it and saying that he couldn't refer to a pregnant person as he. And I said, then stay the fuck out of my patient's room.
Good for you.
And I said, do not go near them. And he was like, don't take it so personally or something like that. And I said, stay the fuck out of my patient's room.
Good for you.
And he was just like, "Woo." And so anytime somebody was about to go in there, I said, he, him pronouns, his name is this. And they were like, okay. I make it known that that is expectation in front of people who are misgendering and misidentifying patients. If you're not as aggressive as I am, that's fine.
Mm-hmm.
But if you are comfortable making it known to the patient that you support them,
Yes.
that's enough.
And I find that with
Um,
students too.
I wish that more people were as willing to open up themselves to scrutiny, or just that people aren't going to like them and because you're that person or whatever. A lot of people don't feel comfortable doing that, and that's fine. But if you can let that patient know that you are there for them and you
Yeah.
are going to respect them, that's like the bare minimum you can do.
That's the
And that
key
can be
to
enough.
all patient
Yeah.
care. I mean, it's a blanket,
Yeah.
whether you're straight or not straight. I mean, every patient deserves that.
Yeah. And the nurse is supposed to be your advocate.
Mm-hmm.
And so if you have a nurse that is coming in and disrespecting you every time they come in, you're going to feel like you never want to go to the hospital again,
Mm-hmm.
that you're going to wait until you're basically on your deathbed to go to the ER.
Exactly.
Maybe that you don't even want to go to primary care because maybe you didn't have primary care before and they've recommended you to one. So why would
Mm-hmm.
you want to go to one that they recommended you?
Exactly.
And a lot of people don't know that there are resources to find care with physicians in an area. It doesn't have to be like a specific company or anything like that, but
Mm-hmm.
you can look for a specific company and ones that offer gender affirming care or that are openly LGBT or openly ally, or, like they have these lists, and I will also link that. But one is called Outcare, and Planned Parenthood
Mm-hmm.
has a list, and you can just go by region. It's like the South Atlantic region for North Carolina, and they have all of North Carolina, South Carolina, and I want to say Georgia, and all of their people who provide gender affirming care are on there.
Which is outstanding. Unfortunately, we don't have enough trickle effect into the more rural areas.
Hmm.
So right now, one of the things that we hear at our PFLAG support meetings is, yeah, I have to go all the way down to Charlotte, for example,
Yeah.
to get my
Right.
gender affirming care.
Yeah.
Um, so, a wish of mine would be that we had gender affirming care trickle up north and
Hmm.
out of the major cities, but also that everybody kind of took on the thinking that you have,
Yeah.
because that's really what we need
Well,
is more healthcare providers that are just looking at people as the individuals that they are.
mhm. And I often will be very blunt with Black people, and I'll tell them that they're at significant risk for certain
Hmm.
medical things. And they're like, oh, based on my history? I'm like, based on the color of your skin. I said, because you are Black, that predisposes you to heart disease. It predisposes you to kidney disease, I think
Hmm.
because of the racism, but the heart disease is definitely specifically for Black people just in general.
Well, I mean,
And
there's
then
even very specific things like sickle cell anemia,
exactly
full
right.
painful
Yeah.
disease.
So apparently Hispanic people can get sickle cell anemia, which I didn't know. But yeah, only Black people basically get it, and then they're treated like shit in the hospital
Hmm.
because they don't express pain the same way that other people do, because it's ischemic pain, it's a little different,
Exactly.
and also they've been dealing with it for a very long time.
Yes.
You get diagnosed with sickle cell anemia either at birth or very early on, like toddler age, preschool age. That's how long you've been dealing with it. I have learned over the years to recognize people that can be helped and to know
Hmm.
and to learn about resources. And that's the main thing, is that I think nurses know very little resources that are actually available to them all the time, which is why I decided to go into case management, because I want to be that person that says, hey, this resource exists, right? And then
Exactly.
maybe that nurse will, next time there's an issue like that, tell the nurse that's talking about it, hey, there's a resource for that, right? Which is why I made this resource zine that's going to be available through Queerlina, actually. They'll have like the PDF version, which again will be linked to wherever this is being shared. There's just so much we can do more in the hospital, and that's why I started giving out those little pins.
Yes.
So in the hospital, I'll just have it sitting on my desk, and people will be like, oh, what are these? Because people love pins.
Hmm.
And I'm like, oh, they're advocacy pins. And they're like, what does that mean? It's just to let people know who they're safe with, and just to let people know that you're there for them. And even just wearing a pin with your pronouns on it is enough to say, like, hey, like, I
That
have
person
pronouns. I
understands.
have pronouns. You have
Yes.
pronouns. Everybody uses pronouns. We talked about Judaism a little bit, but talk about
Yes.
their views as a religion on.
So that's kind of interesting.
Okay.
So, Congregation Emmanuel is a conservative synagogue,
Okay.
and conservative synagogues are kind of going by the wayside these days. People are going more to the Reform and or Orthodox.
Mm-hmm.
So conservative is supposed to be middle of the road, of course,
Yeah.
but conservative synagogues are not really holding their own very well these days.
Mm-hmm.
Um, the Reform movement, which I love for its strong involvement in social justice. The Orthodox movement, not so much. They're a little bit more insular, but the conservative movement can kind of lean whichever way it needs to.
Okay.
But when I wanted to officiate weddings in the conservative movement, they came up with a funny little ruling.
Okay.
And that funny little ruling was it was fine to marry two same gender people to each other, but they both had to be Jewish. And I was like, this is North Carolina.
Yeah.
So because of that, I ended up becoming a Universal Church of Life ordained minister.
Which you can do online in minutes. Yeah.
So, but I'm very thankful that I have studied different religions, through Harvard online and things like that. So I do know some scripture.
Yeah.
But do I really need that when I'm officiating a same-gender wedding? No, I find sometimes a poem is more meaningful and stuff, but I know it. I have it as a backup.
Yeah.
And I will officiate whatever kind of ceremony you wish to have.
And that should be how weddings are. Like,
exactly.
You shouldn't be stuck with the whole, like, whatever. I didn't use the thing when I got married. My friend Mitchell, who's a hairstylist, Cut and Color Works, by the way, in Charlotte. But anyways, he's a hairstylist. He officiated my husband and my elopement, and we signed it on our cat tree in the middle of our living room.
I love it.
And, he just did his thing, and he talked about knowing us for our whole relationship and seeing me happy as his friend, and just did what we felt was important to us. And then when we had our wedding ceremony, my sister acted as the officiant, even though we were already married. But yeah, she did kind of the same thing where she kind of just did a very personal, I know these people and they're going to have a beautiful life together and things like that. So I think that weddings, you shouldn't be like, you have to do it in a church and you have to have this and you have to have that. I think a lot of people are doing elopements.
Yes.
And just going to the courthouse and signing documents. And a lot of people are doing like what you said that you did on the mountaintop.
Yes.
Where you just have a couple people and you go up on a mountain and you get your beautiful pictures and your beautiful outfits. And the pictures, to me, were the most important thing to have.
And
the wedding.
I even have gorgeous pictures from those kinds of weddings. And, I'm so proud. I have a 31-year-old daughter who has a beautiful wife, and they got married outside of Asheville, too. And my daughter did a lot of the DIY stuff. And
I did all my, like, decorations.
And her wife is half Mexican.
Yeah.
And so there were a few throw-ins that were kind of
like cultural,
and Judaism and things like that, and things about the people that we missed, and so my daughter's dad had passed before then, and things like that. But there was a funny point where there was no actual alcohol during the first part of the reception, maybe some wine.
Yeah.
But they let everyone know in the piñata were the mini booze bottles. And so one of the tias did a leapfrog over my grandson when the piñata broke.
Oh my gosh.
He was going for the candy and she was going for the mini.
The liquor. That's hilarious.
Yes. So, I mean, it was just so much fun. And that's one of the things I love about my family. We have queer, we have straight, and we have black, and we have white, and we have Mexican.
You're the traditional American melting pot, which is...
We are, and I think it's so beautiful that way.
Beautiful, which is like what the neo-Nazi... Like, a friend of mine was counter-protesting a neo-Nazi thing, and they're like covering their faces. They know it's wrong, so you're covering your face, and then goes over to her and hands her this pamphlet. And the pamphlet is talking about we need to make America beautiful again, and said something about our homelands. It's not your homeland. We are all immigrants. Unless you are Native American, we are all immigrants. And we all came here and kicked them to their
curb.
reservation. Just anybody who was already here, and they're like, "This is our homeland." No, it's not. No, it's not.
No, and I'll tell you, I would love to see more holistic approaches to healthcare.
Oh, absolutely.
So, I love when I get to go to Institutes for Emerging Issues and meet with other rural clergy, because that's where I get to meet Native American clergy people.
Yeah, because they don't want traditional Western medicine, because why would you trust it?
Exactly. They definitely take a more holistic approach. I think that's one of our failures.
Well, and the Black community as well uses a lot of just like things that were passed down.
Yes.
I've had people come into the ER with onions in their socks and stuff like that.
And raw potatoes.
Raw potatoes, yeah.
Yeah.
And
under their feet.
I don't necessarily believe that that's gonna help, but if it makes you feel better, then by all means, if it's not hurting you, like, cupping is a thing that it can hurt you, but it's also a cultural practice and
Right.
stuff, and there are certainly things that holistic care cannot manage, but, I think that the complementary care
Mm-hmm.
is really important. Like, essential oils do help with things, and having breathing things, and when people say touch grass and stuff like that, like,
Yes.
grounding exercises are helpful.
Mm-hmm.
Praying is helpful, and
Praying is.
me not being a religious person, if somebody asks me if I can pray with them, I'll absolutely do that. I would never say, I'm not a Christian, I'm not doing that. Because it's the same thing as meditating, and it's the same thing as using crystals, and it's the same thing as smudging your house, and it's the same thing as this and that and the other thing. Because positive energy, like positive affirmations, will produce endorphins and help you feel better about
Exactly.
things. So, yeah, it's kind of you could view it as a placebo effect. As a staunch atheist, you could view that
Mm-hmm.
as a placebo effect, but placebo effects help.
Yes,
And
they do.
it's just one of those things where it's like if somebody says that they wanna do a spell or whatever to help me through something, absolutely. You
Mm-hmm.
wanna read my tarot cards and help me just make a decision on something, that's totally fine. Your good vibes coming to me and showing me
Exactly.
that you support me makes me feel good, and like I
Mm-hmm.
said, it releases endorphins, and it makes things better, and so if you know, if you're, like, scared of telling somebody like I would love to pray with you and you're a Christian or a Jew or anybody who prays,
Mm-hmm.
kind of view it from how a chaplain would do that and
Exactly.
say like how can I help you, and then if they say I don't know, you can say can I pray with you,
Mhm.
I'll pray for you, kind of sounds like a
Right. "I'll
derogatory
pray
thing.
for you" was never a favorite slogan of
No,
mine. I
no.
mean, I'll
I'll
keep you in my thoughts and prayers,
yeah,
but
and
not
then
"I'm going to pray for
and not
you."
saying like oh thoughts and
I
prayers
don't
to
order
something.
you around.
No,
I don't write orders for you either.
no.
And I just like I don't judge anybody
Yeah.
because that's not my job.
Right.
Even as clergy,
Yeah.
even as an ordained minister, it is never my place to judge anybody.
Yeah.
And so offering to pray with is
Yeah.
great,
Yeah.
but saying, I'm going to pray for you, yeah, I have a problem with that too.
Yeah. And I've seen clergy do that, which I don't know if maybe they knew that they were Christian ahead of time or something like
Right.
that, but they'll say, let's pray about it or something
Hmm.
like that, or I'm going to pray about it, or, like that kind of thing. But I just offering the patient or whoever you're talking to the opportunity to direct where things are going is patient autonomy.
Yes, it is.
And that, again, is important for healing. Like if you're a Christian, praying is important for healing because it helps you feel like things are getting better
Mhm.
or things can get better or takes away the the stress of I have no control over the situation, so I'm going to
Exactly.
give it up to God kind of
Yes.
thing, which is the same thing as somebody who practices Wicca saying I'm going to release it into the universe. It's a lot of the same things that people view and have their own opinions about.
Hmm.
Um, but
But, again, especially in healthcare,
yeah,
when we just impose our views on patients, that
that's
is just
unethical.
totally unethical. And it's,
Professional ethics.
yes.
Don't they when you are at work, professional ethics, meaning that you are following your organization's mission, vision, values, the nursing association or the medical association's values, which are inclusive, both of them are, and you're following like the values of just like nursing in general, which is patient advocacy. If you're not doing that at work and you're imposing your own religious views or like moral issues or whatever on patients, then that is not okay. That is
It's
unethical,
not. And
and you can report that to the
we
ethics board.
had, I don't know lately, but we had pharmacists who were not comfortable giving out birth control
Mm,
years ago.
mm,
And that was
goodbye.
problematic because they were basing it on their religious beliefs. And you can't do that with your professional
Nope.
career.
Mm-mm.
And you kind of have to recognize that not everybody may have the same religious beliefs as you, and people had to, like, they didn't go out of business, but, people took their business elsewhere
Yeah,
because
as
of
you should.
that.
And that's another thing is that if you have a provider or anybody in the healthcare realm who is not doing what you feel like is necessary for your care, find a different one. For instance, women's healthcare and how you need to advocate for yourself. If you want a hysterectomy and you have reason to, like you have like PCOS or you have fibroids or you have anything or you just want it out, like you need to find a provider who's going to do that. And the way to get your insurance to pay for it, if you have insurance, which hopefully you do, which I know it's hard for a lot of times, but you could also probably get help from different Planned Parenthood or they could point you in the direction of people that donate to those kinds of things to women's healthcare. But if they are telling you, no, I'm not going to do this because you need to continue having your uterus because you're of childbearing age, you
Mhm.
need to get a new doctor.
Definitely.
And I would start with talking to Planned Parenthood about ones that they know of that are inclusive and use your insurance. And the way that insurance works is they work on how the wording is. And if the wording matches what the wording in your insurance is, they will cover it. And so if you make it medically necessary for that patient to have a hysterectomy, their insurance will cover whatever percentage that they cover of things.
Yes.
Yeah, it's just you need to advocate for yourself if you don't have a
Absolutely.
provider that's advocating for you.
And this is in all fields of healthcare, whether it's mental health or
Oh,
physical
absolutely.
health. I mean,
Yeah,
any
if you
any
feel like
field.
you are not moving forward and you have like a mental health professional, whether you've had it for a week or a year, whatever, you have a mental health care professional that is not helping you grow and heal and tackle whatever you want to tackle and get a new one.
Mhm.
And
Please
these
do.
and yeah, and Outcare and, Planned Parenthood and PATH, providing access to trans healthcare in Charlotte, those all have resources for finding all specialties. And so it's not just physical health, and they do mental health, they do acupuncture, they do legal resources. So if you go on those sites, which again, I'll link, you'll be able to find those resources.
And a lot of times you don't even have to go down to Charlotte.
Yeah,
You can do a
exactly.
lot of it virtually.
Yeah, and you can do it virtually or you can pick which specific area you're in because like
Mhm.
Winston-Salem has a lot too. There were some in Catawba County, I want to say, and there are a lot of resources there and you can pick specifically where you are. And then there are also resources for people who are having trouble getting to those appointments and
Mhm.
stuff. Like there is with women's healthcare, there are people who offer their time and vehicles and money to assist people in getting the care that they need.
Absolutely.
And you just have to ask. The worst they can say is no.
Right.
I mean, you can say, "Is there somebody who can take me to this appointment?" And they say, "No, we don't have any volunteers right now." That's the worst that's gonna happen.
Exactly.
So, yeah, we talked about different ethical issues in the medical field and how you got into allyship and PFLAG and being an instructor and how that meant to you, and then wedding equality in the Jewish community. So I think we've touched on everything that we wanted to touch on. I love talking to Beverly about things, especially with like I really didn't like my ethics class in college because they basically did the whole scruples thing and then we're
Mhm.
like, you have to pick one. But my answer was always, but what if or but only if, I always had some sort of modifier for it. Like
Mhm.
if this were the case and this was happening, then yes, but it was always like, no, you just answer yes or no. And that was so frustrating to me.
Yes.
But yeah, ethics was hard for me.
So having, degreed in bioethics, it was really awesome because I got to see the two sides.
Yeah.
So there are two sides to bioethics, and that would be a research side
Hmm.
and a clinical side.
Yeah.
And, some of my cohorts went more research while I was more interested in the clinical side of
Hmm.
things. And we took examples, and how we learned was from things like the Holocaust. I mean,
Hmm.
that was the origin of bioethics, the Nuremberg trials. But
Was
then,
it? I
yes,
didn't know that.
yes,
I
the
mean, I
Nuremberg
knew
trials.
because it was part of one of my classes in the master's degree that I'm doing. They talked about the Nuremberg trials
Hmm.
and they said, should things like that be judged on today's ethics or on the ethics of the time? And I said, well, if you're going to be presenting it in a history, it depends on where you're presenting it. It's unethical because you don't put people in concentration camps and gas them and things like
And
that.
and that's why we're so upset about Alligator Alley.
Right. Yeah.
But on the same token, we have been criminal in some of the things that we've done.
Oh,
For
absolutely.
example, the Tuskegee
Yeah,
syphilis
which is another
experiment.
thing that was in that class, yeah. So what I learned about the Nuremberg trials, that was the beginning of setting statutes of what you could do and not in war
And
times.
wartime,
And so
exactly.
bioethics, I guess, came out of that and being like, we need to have a study of what is ethical for
Mhm,
humans. And so that's how the Tuskegee studies brought on the rules for conducting research on humans. And
exactly.
so there's like a whole law about how you can,
Informed
and
consent.
yeah, so the person has to be mentally able to consent to a procedure or whatever, and they have to verbalize understanding of the procedure that's happening, and they have the ability to pull out of a study at any time. But there's in emergency medicine, there is implied consent, which is that it's an emergency and we don't have time to ask consent. But there are caveats to implied consent because if we know that the person is a Jehovah's Witness and the patient needs a
Mhm.
blood transfusion, they
Fortunately, there's blood byproducts now that
exactly.
can be
So
used.
I talked to a Jehovah's Witness chaplain who was visiting somebody in the hospital that needed
Mhm,
surgery, and he brought a like book of things that we could do for them if blood was necessary.
exact.
And it was just awesome. And I asked him for a copy of it, and I went ahead and I sent it to the Quality Safety and Injury Prevention for the Emergency Nurse Association in North Carolina. And I said, this would be great for trauma
Mhm,
because if you have somebody and they flag that they're a Jehovah's Witness, and there's often a thing that says that they refuse blood, but this resource had what products that may be considered blood products that you could give in an emergency without asking anybody.
what a lifesaver.
I know, and so, knowing things like that and having ethical concerns will delay care, which is why these rules about abortion and gender affirming care are confusing to a lot of providers and
Mhm,
are creating delays in care and creating events that could have been prevented. So there are a lot of things that, like, if a patient's having a miscarriage, can we give them the drug that causes an abortion? Because there's
like,
stuff that needs to come out of there, but that drug is an abortion drug, so it's not
mhm,
gonna be available, or you're just not supposed to give it, and it'll be, like, on your record of, like, something that you prescribed for somebody, and then they'll open up a whole investigation. So that has caused issues and probably deaths for some people. When I was learning trauma stuff, it was
mhm.
always, if the patient is pregnant, you focus on saving the mother
There,
because the mother
yes.
is your patient.
And that falls in line with Judaism. So
Yeah.
Jewish ethics, which was a field that I subspecialized in,
Mhm.
of course, naturally.
Yeah.
But like, we don't even have a term for abortion.
Yeah.
We say that the child is not born until there is some part of that child outside of the womb.
Yeah, and that's how
So,
it should be.
yeah.
Because, I mean, this whole, like, 6-week thing is
Hmm.
insane because a lot of people don't know they're pregnant at 6 weeks, and a fetus is not even considered maybe viable until 20 weeks, and even then, 20 weeks is very low chance of a baby surviving. If you have to give birth at somewhere between 20 and 24 weeks, your risk of losing that baby is high. And
Exactly.
even if the baby survives, they're gonna have a lot of issues, like, they're gonna
Hmm.
have lung problems because you don't get surfactant in your lungs until after 24 weeks.
They're probably 28.
Yeah, and then there's all these issues with, like, brain development and heart development, and things don't finish developing. There's a reason why birth happens. The reason why there's a gestation period is because that's the safe time to have the baby.
Exactly.
And so this whole law about how they're considering these fetuses alive before they're like, "Oh, it has a heartbeat." It's like, "Okay, But we can create a heart in a lab.
Yes,
Yeah,
exactly.
and the heart beats on its own. It does its own thing. These cardiac cells, they beat on their own. One cell beats. So, I mean, but that isn't a human. And
Exactly. And
and
that
you
kind of
shouldn't.
brings up AI too,
Yeah,
even.
exactly. Or keeping people
Soul,
alive on life
having a
support.
soul.
Yeah. Keeping your grandma alive on life support. She's not alive. I mean, if there's no brain activity and they don't expect it to come back, she's not there.
Exactly. So we had a problem with that in Judaism. We would only go by cardiac death for
Mm,
so many years.
yeah.
But now there's a little bit more give.
Like brain death.
Yeah, with brain death.
Yeah.
Yeah. Brain death is still a tough one. I
But
mean, I think I mentioned to you
it's an
that
amazing opportunity to provide life for others.
absolutely. I had wanted to write a doctorate on adding a visual component to end of life discussions. And
Yeah.
it was primarily for brain death
Mhm.
because I don't think that families really understand what brain death is.
Well, and with speaking of
And you
brain.
do have to perform an apnea test,
Mhm.
and
Yeah.
that's the criteria,
Yeah, that's
the
scary.
final
But yeah, to
criteria.
see if they can survive off of
Hmm.
life support.
And
Right.
that's where we get into the discussion of what is quality of life versus
Mhm.
quantity of life.
Yeah, and like I said before about getting hormones that might cause cancer, I would prefer cancer over being somebody that I didn't feel that I was, that I am
Hmm.
not. You know,
Exactly.
if you're unable to take estrogen because it increases your risk of breast cancer, well, I mean, get breast cancer screenings. It's not only preventable, but it's very treatable. And same with cervical cancer. I was just talking to my OBGYN yesterday about how preventable it is. And he said that the only times he sees cervical cancer from HPV is when people don't come in for so long
Hmm.
and after their initial diagnosis. And it's the highest cause of cancer death in women, but is also the most preventable. And that's so crazy to me. And
Exactly.
but also this whole issue with insurance is that people who need to have these follow-up exams aren't able to get them because they don't have an OBGYN. But Planned Parenthood will
Hmm.
do it. And but there's also people don't like going to Planned Parenthood because there's often protesters.
Exactly.
But if you call ahead, they can give you somebody to meet you at your car and walk in and out with you. Whether you're getting an abortion or you're just going to talk to them or you're getting birth control, you can have there's another place in Charlotte that does that too. But
Mm.
they have
Escorts.
escorts, yeah.
Yeah.
And that's where the little pin that says "I'll walk with you" kind of came from. You still have the right and you should have the ability to get care.
Yes. And, that's one of the big things for this country is governing your own body versus the government
Yeah.
governing your body.
And there are
So should we have universal health care?
I think so.
Yeah.
But so what I was told about universal healthcare by a nurse that lives in Canada and works in Canada is that things take longer because
Hmm.
it's universal, but you don't have to pay for anything. And you're able to get all the healthcare that you need. But in Canada, they don't recognize nurse practitioners. So you don't have a lot of these mid-levels that are providing care for us here. So when you go to a doctor's office, sometimes they'll say like the doctor's not available, but you can see their PA or something like that, which is fine for some things and not for others. But if you don't feel comfortable seeing the PA, you can just wait to see the
Well, they
doctor.
have more of a trickle up
Yeah.
versus we're so trickle down these days.
Yeah.
We go straight to a specialist
Yeah.
and then have to
But
backtrack to primary
yeah,
care.
exactly. So you'll go to a specialist because you went to the ER for a problem. And then the specialist will be like, well, we can manage this, but you also need preventative care, which
Hmm.
they don't do. So preventative care is the key to making,
Everything.
yeah,
It's
exactly.
key to everything.
Preventative care is what makes universal health care work so well,
Hmm.
is because everybody can get into their primary care office, their GP or whatever, and everybody can get access to things like their resources for mental health or whatever they need. Everybody has access to those things, whether it may take a while or not, and they focus on your health then and there, not when you have a problem. So, focusing on preventative care is supposed to be the groundwork of the American healthcare system, but that's a joke.
Exactly.
Because
sadly.
if the focus was preventative care, there wouldn't be such a boon in money going to the big companies and the pharmaceutical companies and the healthcare conglomerates and the people who own them and all that kind of stuff. Like 70% of the money that US healthcare spends on healthcare goes back into their pockets. Only
Hmm.
30% comes back into the actual healthcare system, which is not okay.
No, not at all.
And so the insurance companies are reaping a lot of this extra money. If you go to a pharmacy and they don't have your insurance on file, they'll tell you the expense of the drug that you're getting. And then you say, "Oh, I have insurance." And then they run it and now it's like $4, but it was like 500. And that's insane.
We are very upside down here.
It's so upside down. And they say that they're focused on the health of the American public and improving health. How? In what way? And what are you doing about it? Like,
Exactly.
no, you just want to make more money. But when I go to nursing conferences, we talk about these things. Yeah, there's a lot of other things that we've talked about there that I've seen come into practice, or I've mentioned to doctors and they're like, "Oh, that's just like a study that's happening." I'm like, "Yeah, but it's a really good study, but it's not the policy of the hospital, so you can't do it. You can't just say like, "Oh, I'm going to do this instead because I read something
Because
about."
every hospital has a risk management department.
Mhm.
Sorry, not
And
sorry, but that's what it
and risk
is.
management is also a good resource that's underutilized.
They are. Actually, they are.
Yeah.
Because when I was going to the ethics down in Charlotte, we always had someone from risk management.
Mhm.
And so risk
That's a big
management
part
can
of
really
ethics.
be your friend
Mhm.
versus, especially in determining, and this is very important for the LGBTQIA plus community,
Mhm.
hierarchy,
Yeah.
family
Oh,
hierarchy.
exactly. So if you have a kid, a minor, who is making decisions that the family doesn't agree with, you can ask the family to leave the room, but you should get risk management on board with that.
Absolutely.
So if I had a patient who, especially behavioral health patients,
Hmm.
if I had a patient who was trans, whatever, and the family was dead naming and mispronouncing and stuff like that, I would ask the family to leave the room because you're not helping my patient at all.
Exactly.
But I would have to have the patient have a sitter because they're a minor,
Hmm.
and I would have to notify risk management that they're probably going to get a complaint from the parents. But the patient is your priority. And yes, the parents play a role in that, but you have every right to ask somebody to leave the room if they are interrupting the care of your patient, whether it's a parent
Exactly.
or a spouse.
Hmm.
I've asked several spouses to leave the room. I've asked several daughters who were a CNA to leave the room because they need to stop, and they fight with you. I need them to not be in the room while I'm providing care because they're interrupting what I need to be doing. And you have every right to do that. And if they don't stand with you, get risk management involved, get the house supervisor involved, get your charge nurse involved, follow your chain of command and say, this is what's right for the patient, this is what I want to do. And I know it takes extra time and I know it's stressful and I know it makes you look like a problem, but it's right for the patient. So that's what we need to do.
Exactly.
But also, I want to remind nurses that patients who are minors and are able to speak for themselves that come in for any mental health, substance abuse, or pregnancy related, or any sort of sexual health like sexual assault or pregnancy related issues do not need a parent sign off for
That's
anything
right.
that they're there. Legally, you are protected to provide this patient based on their consent as long as the doctor feels that they have the mental capacity to make those decisions.
Saw that more frequently down at Levine and
Yeah,
yeah.
exactly. So if a 16-year-old comes in and they're pregnant and they
We
need
have 13-year-olds
yeah,
come in that were
yeah,
pregnant.
exactly. And they need ultrasounds and stuff like that. I've had ultrasounds say that we need a parent present. I'm like, no, you don't. And they don't need a sitter with them because they came in for their own thing. Also, you need to be really aware of the fact that those patients really need to be screened for domestic violence and sex trafficking. And that's also a thing if a patient is a minor and they come in for that issue with somebody, you need to ask them questions individually. Do not allow whoever's with them to stay in the room while you ask those questions because it could change the answers. And you could miss things like that's not actually my uncle, or that's the person that got you pregnant, especially if the family member or the support person or whoever is being weird about leaving the room or letting you do
Mm-hmm.
anything with the patient. That's a big indication that you need to get the patient alone. And you could ask the chaplain to be your second person to talk to them about stuff.
Exactly.
Or you can ask, your charge nurse or the house supervisor or another nurse that you trust to be there while you're talking with this patient so you can correctly advocate for them. But sometimes it's just that they're sexually active and they got pregnant and they need to establish care. But also there's a place in the EMR where you can change who has access to the chart. So if they have My Atrium Health and their parent is the one that gets the notifications about things in the chart, you can change that access.
Oh, that's good.
I don't remember how to do it off the top of my head, but you can ask the registration people should know how to do that. They can change the phone number that the link goes to, and then if you don't have that phone number, you can't get into that chart. So that's really helpful with young patients who don't want other people um, to know what they're going through as far as sexual and mental health. But that's also
Exactly.
an opportunity to ask names and pronouns and make sure that they are not having issues at home based on their gender identity, and which a lot
True.
of kids do. And if you identify that early on, just based on being aware of the way that people behave or the reasons why people would come in for help, a lot of domestic violence people come in and say they have a stomach ache or something. And then when you ask the domestic violence question, then they answer it, but they don't come
Mm-hmm.
in and say, I'm in a domestic violence situation, I need
Exactly.
help. So, and same with suicidal. A lot of times people are suicidal and they don't outright come in and say they're suicidal.
You know who I wanted to give props to too while we're here?
Hmm.
So I mentioned earlier um, that I go into our local hospices.
Yeah.
I also sit on their ethics committee.
Okay. You wear
And
so many hats.
yes, but I am just really thrilled about how on board they are with the patient's name and pronouns,
Mhm.
and they are very forward thinking
Yeah.
with their patient care. And I think that is so amazing. This is a very special time of life when a person is transitioning.
Yeah.
And to know that our caregivers in the hospices, at least here in Iredell County, but I'm sure every hospice is like that, are that kind of caring.
Every hospice nurse that I've met is like an angel.
Yes,
Like
they
they
really
truly
are.
are.
But
Yeah.
like they they've seen so many people from the
Yeah.
LGBTQIA
And
community because of
AIDS. Yeah.
AIDS. Yes, and so
And just disparities, health disparities where they didn't get
exactly.
help because, like we were talking about, why would you want to go to the hospital if you know you're going to be dead named and misgendered and stuff like that?
Hmm.
You're not going to go to a place where you don't feel safe.
And, it's just, it makes my heart feel better knowing that
Even at
for
the end
that
of care, even
end
at
of
end of
care,
life care.
yes,
Yeah.
I,
Yeah.
I think it's just so important.
Absolutely. And that's, we talk about in nursing school, we talked about how people at the end of life still require dignity and respect. And you
Absolutely.
get patient autonomy from the moment you are able to speak and to show people you don't like things
Hmm.
until you die. And that's how it should be. Because even toddlers, if you're doing something to them that they don't like or whatever that's making them feel weird, they'll
Let you
let you
know.
know. Yeah.
Yes.
Like you should never just go up and hug a kid, especially if they seem standoffish about it. Like
Right.
I think kids that young need to learn bodily autonomy
Yes.
soon too,
I mean,
because
it's like our beloved animals too.
yeah.
Would you just go up to a dog and start loving on it? No. I
Mm-mm.
mean, those of us who own dogs and cats, we know that you let the animal come up and sniff you
Yeah.
and get a feel for you. I
Yeah.
mean, that's how I've been able to, acclimate to pit bulls and
Yeah. Yeah.
things. Yeah.
And even just a stray dog on the street, like, you're not
Mhm.
gonna just run up to it, like,
No,
you
and so you don't wanna do that with your children
no,
either. But,
but, they
there are certain things, of course, like vaccinations or
yeah,
whatever that if the parent wants and, Parents do have the right to decline, which, I'm not in favor of personally. There's that herd
Yeah, yeah.
protection
I
movement,
just want
but
parents to understand that you are protecting other people by vaccinating your child. If your child has an immune response to a vaccine, by all means, do not do that again.
right.
But they have delayed vaccine schedules that you can do if you're worried about your kid's immune response.
Yes,
If your kid has sickle cell disease, they probably shouldn't get certain live
right.
vaccines. If your kid has any autoimmune disease, they shouldn't be getting certain vaccines.
I'm an advocate for vaccinations
Yeah.
and stuff, but I'm just saying that, you know, there's rules set in place too,
Yeah.
public health rules,
And that
and
people have
that
such low health literacy that people don't realize
right,
the reasons why these things are being offered, and that there are reasons why you can say no, or reasons why you can say,
exactly.
I'm scared of that, and just talk to somebody who actually knows something about it would be the first step.
I mean, even, think about, how much you love your motorcycle.
Yeah,
Are you going to wear a helmet?
right.
Yeah, well, it did become state law.
Yeah. Do you love your brain? Because you need a helmet.
Exactly. So sometimes these places are set in place just for very common sense public health
Well,
reasons.
when seatbelts came out, people were pissed about it.
They
People were like,
were.
I'm not wearing a seatbelt. I'm not
They
gonna do that.
were.
And then people in the back seat started having to wear seatbelts, and
Mhm.
children had to be in booster seats and stuff like that. And these things all happen because there's research that says that without this, there is an increased risk of demise. And they're saying we're putting these safety things in place because we've noticed a correlation between this age and this
Mortality
seat
rate.
and this mortality. Or yeah,
Mhm.
like it's safest to put your baby in the middle back seat because of the way that the airbags
And
are
facing the
and
back.
facing the back
Mhm.
until whatever age they're allowed to face forward. But babies should be facing backwards for a very long time. And if you are worried about not being able to see them, then put a mirror back there or something like that. There are
Exactly.
things you can do, like a camera, a nanny cam in the seat so you can hear and see the baby.
I mean, I'm against government interference,
Right.
but there are certain things in place that, for the greater good, are definitely beneficial.
There are some medical people that are on the Senate, I think,
Mhm.
but they're not practicing physicians or anything like
Right.
that. Like there's a couple nurses, and that's great, but there's two nurses against however many else
Mhm.
there aren't. I think that there needs to be a medical council that advises the government to make decisions like that. And it needs to be multi-specialty. It needs to be not just doctors. It needs to be doctors, nurses,
Ethicists,
ethicists.
bioethicists like
Yeah,
me.
yeah,
Yeah.
exactly. Like respiratory
Mhm.
therapists, case managers, like if you need the whole care team, and that needs to be
Exactly.
the care team for all of the American citizens, because somebody needs to advocate for the healthcare, or else it's never going to get better.
So true. So
And
true.
the American Nursing Association and the Emergency Nursing Association, I know for sure, have government involvement advocacy
Mhm.
things that you can get into. So even just saying that you want to learn about what they're doing in advocacy, you can go on either the ENA or ANA's website and put in your email, and they'll email you about things that are coming up. You can go do a silent protest in the Capitol building or something while they're voting on something. And you can go to Day on the Hill, where you go and present things that you want to be implemented, which is how assaulting medical professionals became a felony.
Yep.
And this is how medical professionals are given more rights to say, you can't talk to me like that, or you can't treat
Mhm.
me like that. You can refuse to care for somebody who is
Abusive.
abusive, whether it's verbally, emotionally, physically, whatever, if they've already had a medical exam. That is not an EMTALA violation. And EMTALA shouldn't hold you to being abused by your patients.
Exactly.
You should be able to call the police on patients that are discharged and not leaving the hospital, and are causing problems.
That doesn't give permission for you to be violated in any
No, it
manner.
doesn't. And the doctor should step in and do either chemical or physical restraints. And
Mhm.
we try not to give restraints, but if talking a patient down and doing your crisis prevention intervention stuff isn't helping and they're still trying to hurt you, that patient does need to be restrained. Those restraints were made
Absolutely.
for a reason. And you start with the minimum available, but sometimes you have to go all the way and say, as soon as you can tell me that you are going to cooperate, we can stop. And if you give them medication and they've gone to sleep, you need to take them out of the restraints.
Yes.
Because they don't need to be restrained if they're asleep. They're supposed to have a sitter, and the sitter should have a panic button or have security nearby to let them know when the patient wakes up. So in case the patient becomes violent again, which hopefully the drugs helped them get back in the right state of mind, if the patient becomes violent again, then the sitter is not in danger.
Right.
So there needs to be a lot more protections for sitters as well, because they're sitting like right in the doorway and they're in harm's way. And a lot of them can't even touch patients anyways. And so we should not expect them to go run after them, because what are they going to do? Just be like, there he is, you
Exactly.
know? If a patient runs, you don't need to chase them. That's security's job and that's the police's job. So don't put yourself in danger to chase somebody, because you can get seriously hurt. Is there anything else you wanted to chat about?
Well, I think that's pretty good on my end,
Yeah.
but you can invite me back
Yes,
anytime.
I will, for
Yeah.
sure. And that's what she said. Having titillating topics for the future, still have burning questions from today's discussion, feeling frisky and now you want some action, slide in my inbox at smutdidyousay69@gmail.com to find out how you can get in on this. You can follow Queerlina for a link to education and resources related to today's topics and updates about our next show. Good night, my little smutheads.
Thank you for listening to Smut Did You Say? You can find links and resources mentioned in this episode in the description below. For a downloadable PDF of Nikki's resource handout, along with additional emergent support options for queer individuals, visit queerlina.org/helplines. That's QUEROLINA.org/HELPLINES. Take care of yourselves and each other, and we'll see you next time.